Dear colleagues, welcome to this topic, chronic periodontitis in psoriatic patients. My name is Fernando Valenzuela. I'm an associate professor of dermatology at the University of Chile and Clínica Las Condes, and I am also an IPC concealer. These are my conflicts of interest. I think they are not relevant for this topic today. As an introduction, we all know that psoriasis can be exacerbated by infectious agents, and chronic periodontitis, or CP, is an infectious disease of the dental supporting tissues that trigger a local but also a systemic immune response. And there has been shown an association between chronic periodontitis and diseases such as diabetes and rheumatoid arthritis. Shared inflammatory pathways would contribute to this association. Here we see in the chronic periodontitis the inflammation of the dental support tissues, causing the migration of the junctional epithelium, the loss of the connective tissue, and finally the loss of the alveolar bone. And this is a very high prevalent condition, 60% in general population, and it is increased with age. So older population tends to have more chronic periodontitis. Let me also introduce you to the gingival crevicular fluid, or GCF. This is an inflammatory exudate that comes from the connective tissues that flows into the oral cavity through the gingival sulcus. It's made up of molecules derived from serum, the host cells from the periodontum, and bacterial products of the plaque. And it allows us to obtain samples in a non-invasive way. So we can take this GCF fluid and we can see biomarkers, cytokines, and different molecules. And there's a theory of the associations on chronic periodontitis and psoriasis. And you can see here that most of the inflammatory cytokines involved in psoriasis are also involved in this periodontitis, and so they can be produced locally, but also they can go systemically by blood, for instance. And so it's interesting that some biomarkers can be increased in this GCF fluid and also in psoriasis. So we did a little exploratory research in my university, and we did a complete periodontal exam. We analyzed all the teeth. It was a 45 minutes exam, probing depth, the clinical attachment level, and the bleeding on probing. And we did a case control study. I will show a brief of the results. We obtained 46 patients with psoriasis and 47 controls, and we matched by sex and age. You can see here the psoriatics, 45.7% of this population had active smoking, and this is important because it's one of the main factors of chronic periodontitis. They have a psoriasis in 14 years. 57% had a psoriasis relative, and 31% had psoriatic arthritis. Here you can see the chronic periodontitis in psoriatics and in controls, and you can see that most of the patients with psoriasis had severe chronic periodontitis. On the other hand, most of the controls had no periodontitis at all. So you can see this difference is statistically significant. And here, just to show you patients with psoriasis and severe chronic periodontitis, you can see here dental stones, gum inflammation, and loss of bone, tissue, and teeth. Here we see also the total number of teeth from patients with psoriasis. They had 22 teeth. In controls, they had 25 teeth, and this difference was significant as well. And when we asked patients how many times they had toothbrushing, psoriatic patient 2.2 times, controls 2.7 times. When we asked the patients with psoriasis why they only took twice a day the toothbrushing, they said it was due to the bleeding of the gum. So they were afraid to cause any damage of the gum, and they stopped brushing. We try to see if the severity of chronic periodontitis had any relation with the psoriasis severity measured by PASI, by BSA, by PGA, or DLQI, but we were not able to find any associations, as you can see here or here. But we had this association. The patients with psoriasis had a higher risk of chronic periodontitis compared to the controls. And you can see here that for mild chronic periodontitis, the odds ratio was 6.11. And for severe chronic periodontitis, the odds ratio was 8. And the difference was maintained when we standardized by age. Sorry for this, I wasn't able to translate it. But here we were trying to measure the levels of this molecule S108, and we compare the healthy controls without periodontitis, healthy controls with periodontitis, psoriatic patients without periodontitis, and finally psoriatic patients with periodontitis. And we see here that there is a difference, an increase in the levels of this molecule and on this biomarker, and patients with psoriasis have higher levels with or without periodontitis than the healthy control. Just in a discussion way, in our study, the patients with psoriasis presented higher prevalence and higher severity of chronic periodontitis than controls. They also presented fewer number of teeth and less frequency of brushing than controls, and these findings are consistent with other publications from Turkey, Norway, and Italy. We found no association between the severity of the chronic periodontitis and the severity of psoriasis, and it differs from other studies where the association was observed. We think that in these studies, they evaluated isolated dental parameters, and we performed a complete periodontogram in our study. The chronic periodontitis is a degenerative disease with greater severity being observed at an older age in the general population. Here you can see this is a research from Chile, from my country, and you can see that 81% of the population older than 65 years of age had chronic periodontitis. It's so frequent. In our study, the control group behaved similar to the general population, and in psoriasis group, that trend was observed in association between age and the severity without being statistically significant. The patients with psoriasis presented significantly higher levels of this molecule S108 than the control group, being higher in the group with chronic periodontitis versus without CP. And studies have shown that higher levels of this molecule in psoriasis plaques and also in peripheral blood, so S108 has been postulated as a marker of psoriasis inflammation and at the skin and in blood levels, and maybe it's a new biomarker in inflammation in GCF. So take home messages: First, patients with psoriasis have a higher risk of severe chronic periodontitis, greater loss of teeth, and poorer hygiene habits than controls. We found no association between the severity of chronic periodontitis and severity of psoriasis, but some other authors have found it. Psoriatics present higher level of S100A8 in GCF than the healthy control, being higher in the group with chronic periodontitis. We also found that psoriatic patients with CP had higher levels of interleukin-17 than the group without CP. This result has not been shown in this presentation due to time, and the dental control is essential in our patients with psoriasis, regardless of the severity of the disease. So please, this is so important. As an infection, we must send off all our patients with psoriasis to the dentistry. Thank you so much for your attention, and feel free to contact me. You can send me an email if you have any comments, questions, etc. Thank you so much.